For health, we brought 30 community stakeholders together one day in January, and we said, help us think through what should our county be in 10 years? Should we have zero suicides? Should we have zero opioid related deaths? Should we have zero overdoses? And the one we all picked was lose 1 million pounds in the next 10 years. So we got the community together. You got to set that moonshot, as you know. And once you do that goal, we start working towards it.
Welcome to A&M Healthcare Industry Group's What's Your Moonshot podcast series, where world-class healthcare leaders seek to solve big problems. Listen as we talk to today's health system CEOs about the journey to achieve their moonshots.
My name is Jean Tkachuk. I'm a managing director at Alvarez & Marsal and a co-leader of our health systems practice. I'm joined today by the Honorable Secretary David Shulkin, who is a senior advisor to A&M. I'm very pleased to welcome Dr. Maulik Joshi to What's Your Moonshot today. Dr. Joshi serves as the president and CEO for Meritus Health in Hagerstown, Maryland. He's had a very distinguished career in healthcare management, having served in operational positions in health systems and has been a national leader within the American Hospital Association. Dr. Joshi has a doctorate degree in public health, a master's in health services administration, both from the University of Michigan. He's authored a number of books on the subject of healthcare quality, transformation, and leadership. Welcome to you, Dr. Joshi. Thanks again for joining us, and we're looking forward to hearing more about your moonshot.
Gene, thank you for the opportunity. I really appreciate it.
Maulik, it's great to see you again, and thanks so much. Of course, congratulations on your leadership at Meritus, and you and I go way back. I think it was back in the 90s when you joined and really developed the quality program at the University of Pennsylvania Health System, and then of course you and I did a startup together, which being in the basement of abandoned warehouses and things like that are great experiences. So it doesn't surprise me at all that you're out there leading in healthcare and really trying to stretch for new goals and creating moonshots. So tell us a little bit about Meritus and a little bit about your community and why you went out and established these goals, these 2030 goals for your community.
Yeah, then first of all, thank you, David, for everything. You've given me a lot for my career, so I appreciate everything you've done and obviously the service you've given to our country. So Meritus Health is in Washington County, Maryland, in the western part of Maryland. So we serve about 150,000 people in our county and another 75,000 people between other parts of Maryland, West Virginia, and southern Pennsylvania. We are the only health system in the county. So our mission is to improve the health status of our region. That's our obligation. I was fortunate to join in November of 2019, 100 days before COVID, and we did a strategic planning sprint, a 90-day sprint. I said, you could take a long time to do strategic plans, or we could do it all in 90 days. Let's build on what we have and get it solidified. So over 90 days, we brought together a bunch of community stakeholders. We got input, and we said, essentially, we want to start with what are our 4 bold goals by 2030. So in 10 years, where do we want to be? And in the 4 areas of joy at work, cost, healthcare, and health. So those are the 4 areas. And we picked a bold goal for each of those 4 areas. For cost, it's to be the lowest total cost of care provider in the state of Maryland. For joy at work, it's to be a nationally ranked employer of choice. For health care, it's to have zero patient harm. And for health, we brought 30 community stakeholders together one day in January, and we said, help us think through what should our county be in 10 years? Should we have zero suicides? Should we have zero opioid related deaths? Should we have zero overdoses? And the one we all picked was lose 1 million pounds in the next 10 years. So we got the community together. You got to set that moonshot, as you know. And once you do that goal, we start working towards it. So that's how we came up with that. And then COVID hit, but we had our plan at least in place.
Mark, none of this surprises me. The fact that you're out there thinking about these bold goals, the fact that you're using a rapid sprint process. You might as well get the job done if you can do it in a shorter period of time. And this is exactly what leaders should be doing. So let's focus on that moonshot of losing £1 million for the community. How do you go about doing that? And how's it going so far?
Yeah, so our approach is a campaign, right? You got to take this, you want to get the vote. So you want to get pledges from everyone. So we started with, let's launch this. Here's our goal. We started talking to all our community partners, the Washington County Public School System, all the employers in the Chamber of Commerce, which is a number of them. And we started going to them and say, hey, do you want to pledge certain number of pounds for your employees for the next 10 years? And we started going back just by hitting the ground. We had 75 partners signed up by the fall of last year, and they've pledged 200,000 pounds. Now, again, we have this distraction of COVID, but they all pledged. So we have that going, and we have to revisit that and re-engage. The other part we did is we created a very simple weight calculator. It's on our web, and we do it under Healthy Washington County, which is our local health improvement coalition. We are part of it. The health department's a part of it. We're all a part of it. So on that, you can go in and just record your weight at different dates and times. And it's simple as that. We then kept going and we went to our employees first, right? Because it all starts at home. You have to be the role model. So for our employees, our wellness incentive, you get a credit off your health insurance premium. And what we said is to get the credit, you have to enter your weight, both in the beginning of the year and in the end of the year. We don't know your weight. We're just looking at the difference. And you should do activities. It's whatever activities you want, 100-mile bicycle race, 5K, you pick, but you have to do something a quarter and you have to report your weight. So again, COVID's been in the way, but since then we have over 1,000 registered users at Meritus, and we've already documented 5,000 pounds lost. So it's a start. We've got a ways to go, but we're starting.
Maulik, you got to think big. And, as a hospital CEO, I was always asking people to pledge dollars, and you're asking them to pledge pounds. And I think that's really terrific. I know Jean has some questions for you.
I'm particularly interested because I see some important links in your 2030 goals, particularly between your initiatives to improve the cost to provide healthcare, along with your very bold goal to lose £1 million for the community. And so I'm wondering, and understanding maybe you haven't done this all quite yet, but I'm wondering how you have or how you will connect those two. So are you tracking the health outcomes or other health indicators for those who have pledged pounds, whether it's hypertension, diabetes, other things that really contribute to the overall cost of healthcare. So what are you doing about that, Maulik?
Yeah, great question, Jean. And it is early, so I have to just be honest about it. But for losing £1 million, we have an annual operating plan. And within that, we have key strategies. So managing your stress is definitely one of them. Hypertension is definitely one of them. And exercise or activity is the other. That's what we're doing for the next 2 to 3 years, and then we'll keep building. So we are tracking, do you know your numbers and measuring your blood pressure, but we're not at the stage of linking the two. But the message to our community is income, education, and health are all connected, deeply correlated. And so losing £1 million is going to help us. Education is going to connect, and income is going to connect. So that's why if we're affordable for our community, that's going to help the income. And if we're working on health literacy and all the issues around managing your stress and others, that's going to help your education. So we're trying to connect the three as the community message. This is about the community. We're one part of it, a big part of it, but one part of it.
No, Maulik, I was going to ask you, I know that throughout your career, you've been very big on transparency. Are you planning on posting the number of pounds lost on your website so people can track how the community is doing?
Yeah, we haven't done it on the website, but we've done it on our digital board. So if you drive through Hagerstown, you're going to see a line that says 5,007 and $1 million pretty far up. But yes, the other thing is, you'll appreciate this, David, we are completely aligned. So one of my senior leader incentive measures is to lose 5,000 pounds this year. I mean, so that, if you think about senior leaders putting their money where their mouth is, obviously margin, patient harm, patient experience, but losing weight in our community is one of our measures. And it's cascaded down to all the leaders at Meritus Health. So they have obviously their own metrics as well, but the corporate goals, this is one of them, is a part of their incentive plan. So we're really trying to connect the dots so that we all are a part of this.
I love that, Maulik. Are you thinking about a role for the hospital in terms of providing food? Are you thinking about food pharmacies or farmers markets and things like that?
Yeah, great questions. I think what this has done is made us really connect the community health needs assessment to a specific goal. As you know, a lot of community health needs assessments could be done every 10 years, not even every 3 years, because the issues don't change, right? Unfortunately. So this has now said, oh, we do have a higher obesity rate, teen pregnancy rate, and all these things in our county. So let's really connect why we're doing that. So we've just started that. Food is obviously a big one. Transportation is an issue for us in our area. And then, of course, the one that I care about, but it's hard to get to, is loneliness, social isolation. That contributes, as you know, mentally and physically so much. So we're just starting that. So we've started getting our mobile van going. Right now, we're doing all the vaccinations out in the community beyond our own site. So we're getting to more outreach. I think this is just making us more purposeful in our outreach in terms of why we're trying to do it.
Are you incorporating kind of the whole family in this? Do you have education or other outreach resources where one person might register, say grandmother in the family registers? Are you providing resources or encouraging others in the family? Because I know that kind of the whole family dynamic is frequently such a driver of obesity.
It's a great point, Gene. We have not done it as much as we should. That's something on our list. Obviously, the virtual education that we've been doing has been more isolated over the last several months with COVID. But as we move forward, and diabetes is a big one on that, because I think once you connect food, diabetes, and weight, you're getting the more family involved in that. But we have not gotten to that level yet.
Well, there's lots to do for sure.
It's true. And again, it's the campaign model. We want to approach this like a campaign. Campaigns are good, but it's not about just getting to see people. You want the vote. And I think the pledge of pounds and everybody committing to it, that's going to be the key to this. We all have to have a piece of this.
Mm-hmm. What about the health plans? Are the health plans partnering with you on this?
It's a good point. So we have a Medicaid health plan that's pretty strong here. The commercials are we have multiple plans. So we have yet to really jump into that relationship, but we are starting to talk to them about more value-based arrangements. And this is a part of that. It's not just the clinical measures, it's also the losing weight. So that's where we're headed. It's a good point. We're just a little bit more different, but the partners, I have to emphasize, we're the largest employer in our county. So, but the school system, the county health department, the county employees, there's a lot of potential partners, and like a campaign, you got to enlist them all.
Right. The health plans should be some of your biggest cheerleaders, Maulik, for sure.
Absolutely.
Maulik, I was just doing a back of the envelope calculation. If other healthcare leaders took your moonshot across the hospitals with over 5,000 hospitals at £1 million a hospital, we'd have 5 billion pounds lost in the United States. That would be a big deal for the health of the country.
That's a great, and not only that, that's something we can do today. I feel like, again, this is not to put down community health needs assessments, but it's given us like this, we got a lot to work on all that. This is saying, let's do it. And we have our own employees to do it with, right? And it's easy to track.
Yep. So Maulik, I have to ask you, what happens if you don't get there? What happens if you fail? You're only at 5,000 pounds. You're a long way away.
Yeah.
Some trends are working against you. So what's your attitude as a leader if you don't make it?
My attitude is Washington County is 18th out of 24 in the state of Maryland in health outcomes as a county. There's no reason why we shouldn't be in the top few versus the bottom. And so I don't view failure as an option. We have to keep going, and it's keep doing the same thing. So if we get to 800,000 pounds, that's completely fine. Directionally, we have to get to this culture of health. So I know we'll do it, but there's lots of barriers. It's the drumbeat, right? You have to keep at it. And there's a high likelihood of failure, I guess, right? But got to try. As you know, goals
Yeah.
serve as artificial floors and ceilings, right? So we could have just said we'll lose 10,000 this year and 10,000 next year, and that might have been good, but then you're only going to work towards that. If you really work towards a million, you change what you're doing.
Right. Well, Maulik, as I've said before, it doesn't surprise me you have a bold moonshot. We're rooting for you. We do think you can get there. We hope other leaders will be inspired by your leadership. And thank you so much for joining us on What's Your Moonshot?
Thank you, David and Jean. I so appreciate it and appreciate all that you're doing.
Alvarez and Marcel. Leadership, action, results.
Thanks,
Easy.
Maulik.
That was actually
That's
quite
great.
fun.
Honestly, I love it.
So for us, it goes back to the mission. 2/3 of health status or whatever appropriate ratio is non-medical care, right? Health behaviors, social determinants of health, it's all that stuff. We still have to do medical care great, and we have to get better at it, whether you're in the ED, at home, doctor's office, hospital, ICU, you got to do that. But our mission is improve health status. So that's why we're doing this. So I think when you pitch it that way, that's why we exist. And, for the providers and others, that's why they got into the healthcare, right? Is to do that sort of work. So I think that's the connection. It is a shift. We haven't figured out the business model completely and all that stuff.
Right.
We still have to take care of people as well when they're sick. But this is what we should be leading more with versus lagging.
No, I was just going to say, I think you're right, but so many healthcare leaders, as you know, Maulik, get stuck on, well, we're not going to get paid for it, so, how can we focus our time and energy and attention if we don't get paid for it? And yet you're absolutely right. That should be the mission of these institutions, is just, as you know, this is lip service, the things that are community wellness programs or one of the things that always strikes me, the community benefit reports that have to be put out. If you really look at them, they support golf tournaments and things like that. But
again, I'm learning from you. I'll tell you, it's you do the right thing and the money follows. So I'll give you one. I'm sorry if it's distracting, but COVID testing. We can process our own COVID tests. We have a lab that's been able to do it. In 14 months, we've done 140,000 COVID tests. 140,000. Our county's 150,000. We have, 25% of the people coming from outside our county. We've never dropped a patient bill, never a doctor's note, never an order. If you can drive to our what I call 2 trailers under a wedding tent in the back of our medical office building, you'll get tested and you'll get the results in 18 hours in my chart. Never dropped a bill, and we're doing fine. Right.
Right.
So if you do the right thing, vaccinations is another one. My view is vaccinate as fast as heck as you can. Don't worry about the money. It pays off, right? And I think if you view it that way, if you did a P&L for this, we'd all be like, it's not going to make money. Well, who cares? You got to figure it out.
Right.
Yeah, it's going to make a difference, and I know that's what you're trying to get at. And the money will follow. I believe that too, and that's why I mentioned the payers, right? And the payers frequently are the potential partner in this that has the data, right? They are the best view into that data. So as this progresses, it'd be fascinating to maybe follow up and learn more about how you're going to really tie those things together with cost. But not just the cost within your system. Like if you could get that payer's cost, get that Medicaid plan to really share and say, this is really what you've done or contributed to in the aggregate, would be fascinating to see. And it's great that you have kind of longer term goals here, because that's the other thing. Those things don't show up in, next quarter. You really have to look at trended data over time. So it would be great to be able to follow up with you and see how you're doing.
Absolutely. And that's a great thought. I appreciate it.